Morning, Mrs. Abbott. I'm Dr. Thomas. I understand you're here to discuss planning to have a baby?
Yes, Dr. Thomas. My husband and I have tried for some time to have a baby now and haven't been successful. We thought you might be able to offer some words of wisdom and maybe some cautions too.
Well, I'm glad you came to see me now. I find it helpful to discuss your medical history as well as evaluate whatever underlying medical conditions you may have. I'd also like to provide you with as much information as I can to help you prepare to have a healthy pregnancy. Now, do you have any questions before we get started with the history?
Yes, I do. Since my husband and I have tried for so long, does that mean that if I ever do get pregnant, we're likely to have some problems at my age?
You know, I really can't answer that until we go through a complete medical and genetic history. What I can say is that age increases the risks for chromosomal abnormalities like Down syndrome and other conditions. However, most mothers over the age of 40 do not have children with these conditions. In fact, most children with Down syndrome are born to mothers under the age of 35.
Well, is there any way to know ahead of time if I'm going to be one of those mothers?
Again, we need to get some basic information first. There are certain genetic conditions that do run in families, but most chromosomal abnormalities like Down syndrome typically are not inherited. Now, once you become pregnant, we can offer you a diagnostic test for Down syndrome. Typically, that's an amniocentesis or a chorionic villus sampling, what we call a CVS. Now, some women don't want to start with these procedures because they involve a small degree of risk to the pregnancy, so they choose to start with screening tests first. Now, the screening tests typically involve a blood sample or an ultrasound or both. Now, what these screening tests can do is estimate the risk, but unlike the amnio or the CVS, they cannot provide you with the definitive diagnosis. Before we get into any of that, I want to refer you to a reproductive endocrinologist and an infertility specialist, because I know you and your husband have been trying to conceive for a long time now.
We would like to see an infertility specialist, but what do you mean about screening after we become pregnant?
Well, there are tests that help us determine the likelihood of you having a child with chromosomal abnormalities like Down syndrome. Typically, we draw blood to look at the levels of certain proteins that are associated with an increased risk. And in some of the screenings, we'll also do an ultrasound to look for physical characteristics that are associated with Down syndrome. Now, the problem with these screening tests is they just show you that you're an increased risk to have a child with these conditions. They can't say that you will have a child with these conditions. For example, the screening test may say that you're at an increased risk, but your child will be perfectly normal. Then again, the screening test could say that you're not at an increased risk and you could have a child with these conditions.
Well, I see, but if they're so inaccurate, why do them?